It's a really broad topic, but I think pretty much everybody knows somebody in their life who's had heart failure. I think the number that gets thrown around is about 50 million folks walking around with heart failure in the United States. And it's a big burden in terms of healthcare and resource utilization and cost and all that. So heart failure has everybody's attention. So I think it's just good to have sort of a framework for everybody to think about and talk about heart failure, because it can be confusing. It's a broad enough topic that we try to break it down in different ways, and you can look at it from a lot of different perspectives. But in general, to understand, heart failure, you have to understand what's a successful heart and what does that mean. So just kind of some very basic ways to look at the heart. Your heart, when it's functioning well, is a pump. And it takes a few different systems to make the pump work right. So there's the electrical system, and there's kind of the plumbing, and then there's the muscle, the pump that does the work itself. And so when we're talking about heart failure, most of the time we're talking about the pump function of the heart. And so kind of the most common way that people think about heart failure is when the pump starts to fail. And there are different ways to have heart failure. You can have heart failure with a pump that seems to squeeze quite normally. So if you think about your heart as a chamber, we're talking about one of the very specific 4 chambers of the heart, the left ventricle, or the big thick one on the bottom. And so it relaxes and it fills up, and then it contracts and it squeezes out. And each time it squeezes out a certain amount of blood flow. And so in cardiology, we use this term all the time called ejection fraction. Some of you guys probably have heard that thrown around and understand that. Sometimes people get confused about ejection fraction because what's normal gets termed a percentage. So if we say a normal ejection fraction starts out at about 50%, and you tell somebody their ejection fraction is 50%, immediately they think, oh my gosh, my heart function is only half of normal, I must be in real trouble. But 50% is a normal number. And so the way we calculate that is, when the heart relaxes, let's say 100 cc's goes in and then it squeezes and 50 goes out. Well, that's an ejection fraction of 50%. If 100 cc's goes in and only 30 goes out, well then that's 30%. So we start calling it normal at about 50%. Somewhere between 30 and 40% is kind of what we would say moderately reduced function, and then less than that we call severe. That's really only part of the story, but that's the one that's easiest to kind of get your hands around and sort of start to classify how well is the heart squeezing.